afternoon, everybody. We are live here at Johnson Dermatology with our newest dermatologist, Dr. Garrett Nelson. He has been busy today doing skin cancer surgeries. You guys may have already met him if you've had any skin cancers or anything cut out or any surgeries here recently. We love Dr. Nelson. We're so excited that he's in our practice. He's excellent, but we are making him take a Brotox break. So he has not had his Botox in 3 months and he is due. So we're going to live inject him today. So if you want to zoom in on him, Danny, so we can show them what we're going to inject. If you want to just squint into the sun there, you guys can see here where these muscles are super strong and giving him crow's feet. So we're going to use the FDA approved amount of Botox, which is 24 units to treat that area and relax that muscle so that he does not develop lines of rest. And then if you want to make your thinking face here, you can see the 3 muscles here that make 11s. We're going to relax those muscles so that he doesn't get lines there. And then when you raise your brow, these strong frontalis muscles here in men, we like to relax those. We don't want to lift his brows. A very masculine feature is having a flat brow. So when you look at some of the women that get Botox and you see a beautiful arch there, that's very feminine. We're not going to do that to Dr. Nelson, okay? So let's go ahead and get him laid back here. Chair is going to make up Dr. Nelson, and then we're going to adjust this headdress. The first step is just to clean him off. One of the benefits of a core specialty like dermatology injector is that we use very clean techniques and decrease the risk of infections. There is a very, 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 very low risk of infections with cosmetic procedures, but we take all of the right precautions. So we also, you may notice as Bridget is cleaning him off that she has been icing him with the ice packs. We use these to help with pain reduction and to lower our risk of bruising. We have a very low bruise rate here at Johnson Dermatology, and we want to keep it that way. So first we'll just do these crow's feet. Smile big for me so they can see. You guys can see that muscle pulling there. You can relax, Dr. Nelson, and go to your happy place. Welcome to our clinic and some of the best injectors in the River Valley. We are excited that Dr. Nelson is joining our cosmetic practice because we know there are lots of men that want Botox and maybe want a male injector. And so now Dr. Nelson is here. Make your thinking face here for me. Okay, you can relax. One thing that I didn't mention about Botox when I was talking about it is, you know, lots of men, they fear that they're going to look feminine when they get Botox. It's kind of like there's only certain men that can wear a pink shirt and still feel really masculine in it. Botox is not like that. Anyone can get Botox from the right injector and still look very masculine because no one is even going to know you've had Botox when you've come to Johnson Dermatology. So we're going to inject up here now. Sorry, I got to talking a lot and didn't, took a break from injecting you. And so raise your brows over here for me, Dr. Nelson. Great, you can relax. We're just going to put a tiny bit of Botox over here. Great. Another thing that I should mention, if anybody is watching and noticed my very fashionable shirt. I'm trying to wink at Danny so y'all can see it. It's from Indy, which is a store downtown on Garrison, which is currently running a huge giveaway with us on our Instagram. And our Instagram is Johnson Dermatology. Indy's is Shop with Indy. Each store that is in the giveaway, Sweet One, Hazel's Haven, Roots, are all, and us included, are all giving away a $100 gift certificate. So that's $500. So we want you guys to run over to our Instagram or one of those stores that I just talked about, Instagram, and enter our giveaway. It's going to run throughout this month, so don't miss out on it, okay? All right, let's get back to injecting Dr. Nelson. He doesn't want to hear about my fashion, do you? He wants to get back to skin cancer surgeries. Perfect. You guys can see Dr. Nelson's vessels So we today don't want you straining, Dr. Nelson. We don't want you getting any bruises. Raise your brows over here for me. So we tell, and you can relax. So we tell all of our patients, no heavy lifting, no straining, nothing that could make you bruise the day of your Botox. But other than that, he is off to surgery. But before he gets off, Dr. Nelson is only the second male to ever work at Johnson Dermatology. So him and Dr. Brad are male employees, and we want to welcome him. Are you not seeing me? She can't see me. I'm not close enough to Dr. Nelson. So what better way to embrace having another male at the clinic than watching him inject another male? So we are going to watch Dr. Nelson. I'm going to do it. Okay. We're going to watch Dr. Nelson inject Jeremy. So is he looking good?
Yeah, he looks
great. All right. We're going to set this up.
Thank you, Nina. That did not hurt at all. So
it's an easy procedure. All right. So Jeremy, why don't you step over into the chair here? So, Jeremy, is this your first time to ever have Botox?
It is.
We are very excited for you.
Excited.
So, men tend to have larger muscles and stronger muscles, especially men that work out a lot, like we know Jeremy does and stays in shape. And so Botox in men that work out a lot is really important because you want to work out and stay healthy, keep your muscles up. We just don't want those muscles that are on your face that make lines at rest to be too strong, causing you lines to make you age prematurely. So we are going to prevent that. And that's the nice thing about Botox is that Botox is really preventative. And so what we're doing is we're relaxing the muscles that make lines in motion so that you don't develop lines at rest. So why don't you make your thinking face for us and kind of that muscle there and show us how big those muscles are and raise your brows really hard. So you can see he's got strong muscles there. So in Jeremy and Dr. Nelson, I'm probably stealing your thunder and talking too much. I'm sorry.
That's all right.
In Jeremy, we're going to leave his frontalis muscle. You can see how he raises that brow there. We're going to leave that alone for now and inject his glabella, or the muscles that make his 11s, because that muscle, you can see it just at rest. Don't move at all. And you can see that muscle almost protruding right here. So you can see that muscle without him even making his face. So we want to relax that muscle. So why don't we lay you back here?
Yeah, not too far. That's good right there.
It's good.
And so those are just a few of the differences between injecting a man and a woman, is that men have a lot stronger frontalis muscles and facial muscles in general, so we're not going to inject his frontalis muscle because we don't want the eyebrow raise. We want it to more have a natural look. And the goal for men is not necessarily to have a frozen look, but just to have a more natural look, a more youthful, rested appearance, and not so much of the frontal frozen look. We still want to be able to make our facial expressions, just maybe not look as mean and angry all the time. And so that primarily comes from these number 11s right here. Go ahead and make a scowl for me. There we go. So you can see he's got number 11s right down the middle. After a week or so after this, he probably won't be able to make that face as much. So we're going to go ahead and make that face for me again. Perfect. And we're going to go ahead and inject. You can relax.
And Dr. Nelson made a really good point with men having larger muscles. Oftentimes, those muscles require more Botox. And so, you know, the FDA has approved 20 units for the glabella, but we're going to go ahead and have Jeremy come back in 2 weeks when his Botox is completely set in. And if he still has too much motion there and he's not relaxed enough, we will add that right back on in.
All right, so we're going to do the rest of his glabellar muscles now. Go ahead and make a scowl for me again. All right, and relax. This is getting into the corrugators. How is that, Jeremy? Is it painful?
No,
Good.
not at all.
I know you probably wouldn't admit on camera that it was painful, but it's really not. I've never, every time I'd had Botox prior to this, I never had the ice. mainly because I was still in training and you didn't get pampered. So it was just a large rusty needle, and it never hurt. And so you really don't feel anything when there's ice involved.
And we do lots of things for comfort. You can see Danny there tapping. That is the gate theory of pain in action. So we're tapping him to trick his brain into not seeing the pain signals because we're tapping him.
12, 16. That's a perfect amount. All right. Go ahead and smile for me. Big smile.
Squint to the sun.
Squint.
Squint.
There we go. So you really don't have much in the way of crow's feet, but we'll still inject it. Go ahead and relax. These sting just a little bit more, but still shouldn't be painful.
Sometimes around the eyes or anywhere we put a needle, there is risk of bruising. When we do that here at Johnson Dermatology, if you do have a bruise, we have lots of tricks. So we have a laser for bruising, and there's some topical gels that we have for bruising, and we tell people to eat pineapple and watermelon. Also, which Jeremy does not need this, but Kybella is something that we use for men a lot, and that's for submental fullness or for contouring the chin. And some people use the bad word double chin, but we don't say that here. But we will be injecting that live tomorrow night at 5:30, and we will be giving away to one lucky attendee a full year of free Botox. So if you want your husband to start Brotox, bring him to the clinic tomorrow night at 5:30. He might win a free year, and then you could easily talk him into it, right?
All right. Well, here we go on this side. So we'll do 4 sites on this one as well.
And just like Dr. Nelson said, I've never, ever had anyone not get Botox again because it hurts. It just doesn't hurt.
The results are so good that you'll come back.
Yes.
And it's really not that painful. What would you say, Jeremy?
I didn't know anything.
So there was a recent study, and I don't know if it was anecdotal or if it was actually a study, but the male aesthetic market has grown 300% in the past 10 years. So 3 times as many men are getting minimally invasive procedures like Botox now as opposed to about 10 years ago. So even if you think none of your friends are getting it, they are. So the average age of the male that gets Botox is about 42, somewhere in the early 40s, because that's when they start to see those permanent indentions, the number 11, show up in the glabella region, and they're starting to notice their crow's feet. But we have men as young as 20s coming in as more preventative. Jeremy, at rest, you don't see any of those number 11s, but especially if you have a stressful job or you're always scowling or maybe have an angry appearance overall, this will really soften it. He'll have all his facial expression in a week or 2 whenever he comes back, but at rest you won't be able to see those number 11s. So it's more of just a softening of the male face. We don't make it look feminine. You're not frozen. And pretty much all guys I've ever seen have always come back for more. So this is my 3rd time, and it's not feminizing at all. I can still move all my muscles. You don't have a frozen face, and really nobody can tell, except people that inject it all the time.
Yes.
And they can only tell because it wears off.
That's right. Well, thank you guys for joining us today and helping us welcome Dr. Nelson to our clinic. We have openings available for you guys whenever you're ready. Just contact Danny, our cosmetic coordinator. She's ready to see you guys. Take care.
Side note, tomorrow we're also going to be giving away 2 syringes of Voluma along with the 1 year of Botox. So come tomorrow at 5:30 for the free giveaways.
We'll see everybody tomorrow.